course, it does affect on the immune system, the thyroid gland, but not the direct effect that we want to believe. Many people from many years ago, many doctors, have noticed that women who they have problems with their thyroid, they have also problems with infertility. So what was the simplest conclusion we can make? That if we fix the thyroid, we improve fertility. It works a little bit like this, but I do believe that there is a common factor for this problem. Imagine that on the top is the thyroid, and next to it is the immunological problems. We draw a line, and underneath is the immune system. The irritated immune system is the one that affects the thyroid, and the irritated immune system is the one that affects fertility. But we only see the connection between the thyroid and then fertility. By treating the thyroid, we come again to what I said before, that we remove an extra reason for the immune system to be agitated. And this thing helps. Also, because you mentioned the thyroid, it's very characteristic that a lot of women with immunological problems or with an imbalanced immune system, they have very low vitamin D in their blood, low ferritin, but especially the vitamin D, it's very characteristic. Many people, they say, okay, I have low vitamin D, please take some vitamin D. Helps. Vitamin D is very important for the immune system. But with my treatments, I have noticed that without giving vitamin D, the vitamin D throughout the treatment gets higher and higher. Because the problem is not from the lack of the vitamin D. I don't believe that somebody in our modern world have lack of vitamin D. I believe that the problem is how the body deals with the vitamin D. And an aggressive immune system, for some reason, is not allowing the vitamin D to be in our blood. Yes? It's very characteristic how the vitamin D goes higher when you don't give vitamin D, but you just give immunological treatment.